Hi, I'm Igor, and today we will go talk about thromboangiitis obliterans or Buerger disease. What is the disease? The definition is also known as Buerger disease. Is an inflammatory non-atherosclerotic vaso-occlusive disease affecting small and medium-sized vessels of the extremities. Epidemiology prevalence up to 20 cases per 100,000 individuals, sex more in men than women, 3 to 1, and age of onset before the age of 45 years. Etiology. The exact etiology of thromboangiitis obliterans is unknown. Tobacco consumption is a single most important risk factor for thromboangiitis obliterans. Pathophysiology. Thromboangiitis obliterans is an inflammatory non-atherosclerotic vaso-occlusive disease affecting small and medium-sized vessels of the extremities. Histopathological phases. Acute phase, inflammation of the tunica intima and arteritis with neutrophilic infiltration and microabscess formation. Inflammation may extend to the tunica media, but the internal elastic lamella usually remains intact. Formation of a high cellular inflammatory thrombus. Intermediate subacute phase. Mononuclear cell, fibroblast, and giant cell replace neutrophils. Thrombus organization. Chronic phase. Organized thrombus. The inflammatory process may extend to the adjacent veins and nerve, resulting in an encasement of artery, veins, and nerve in a fibrous sheath. Clinical features. Thromboangiitis obliterans affects the small and medium vessels of the extremities. Other systems are only very rarely involved. Clinical features include migratory superficial thromboangiitis, thrombophlebitis recurrent, often seen in prior to the onset of limb ischemia, tender nodules along the course of the affected vein, induration and erythema, Raynaud phenomenon, and chronic or acute limb ischemia may progress from distal to proximal vessels, intermittent claudication, pain at rest, cool extremities, and or diminished or absent pulses, ulceration and or gangrene of fingertips and or toes. Digital may amputate. We see gangrene of the finger in patient is thromboangiitis obliterans, amputation of patient is this disease, and ulcer formation. Diagnosis include laboratory studies. The following studies are normal: ECR and CRP, autoantibodies, antinuclear rheumatoid factor, and anti-citrulline antibodies coagulation studies, all normal. On angiography of the femoral artery, we see occlusion of the femoral artery. Imaging studies also we include angiography, finding segmental occlusion in the distal vessel of the extremities, corkscrew-shaped collateral vessel around the site of occlusion, because its compensatory reaction, and normal proximal arteries without evidence of atherosclerosis. Additional studies include ankle brachial index may be decreased, biopsy may be considered in patients with tender nodules and or superficial thrombophlebitis, a typical location, large vessel involvement, or age of onset more than 45 years of age, typically show acute inflammation of all layers of the vessel wall accompanied by occlusive thrombosis. Treatment, prevention, and supportive care. Abstinence from in any form of tobacco, smoking or chewing tobacco, nicotine patches, or gum. Most effective measure for reducing symptoms. Decrease the risk of amputation if started early in the disease course. Protection of fingers and toes from cold and mechanical injury. Use wearing gloves and appropriate footwear. Complete cessation of tobacco consumption in any form in the single most effective therapeutic measure. Even nicotine patches can reactivate Traumatizes obliterans. Treatment. Support symptomatic therapy include calcium channel blockers, nifedipine, and amlodipine, and iloprost. Surgical therapy. Patient with ulcer may require debridement and antibiotic therapy for soft tissue infection. Patient who develop gangrene require amputation, revascularization procedure, for example, bypass grafting, angioplasty, and rarely feasible because vascular involvement tends to be diffuse and distal. Thank you. Subscribe to the channel.